G'day, welcome back. In this lesson, we'll dive into the most effective mobilization techniques to free up stuck cuboids. This is where you get your hands on feet to use a highly effective treatment option for cuboid-related problems. This is an invaluable skill that's revolutionized how cuboids are treated all around the world. In this lesson, I'll show you two cuboid mobilization techniques. The first technique is when the patient is seated in a supine position. Second technique is when the patient's lying face down in a prone position. Now, both techniques work equally well. The reason why I'm giving you the two options is so that you can do the mobilizations in whichever position suits you. Some practitioners do foot mobilization therapies with their patients supine, and others do it with their patients prone. I'm going to let you decide what works best for you. Therapeutically, they're both as good as each other. Alrighty then, you'll remember in the first lesson how we discussed why cuboids get stuck in the first place. If you haven't watched that video, go back and do it because this lesson is based on the principles presented in that first lesson. Okay, so do you remember the typical displacement pattern that the cuboid goes into in the pronated foot pattern? Well, the cuboid typically everts, meaning the plantar surface of the cuboid faces away from the midline of the body. This happens in the frontal plane. So that means the direction of correction required to restore the cuboid to its optimum functioning position is going to be to invert the cuboid. That's because, as you know, inversion is the opposite of eversion. Okay, there's a number of setup steps you must get right to deliver an effective manual therapy service. Please make sure you've downloaded the Cuboid Mobilization sheets so that you can fill in the blanks as we go along. This will help you master the skills in no time. Okay. So let's quickly review the clinical indicators for mobilizing the cuboid. They are 1. Lateral foot pains located at the cuboid-related articulations. Remember, this usually presents as rather vague or non-specific discomforts or symptoms along the lateral border of the foot. The second clinical indicator is perineal compensations, which can be around the cuboid but can also extend up the perineal muscles of the leg. This leads to the third indicator, which is fibular compensations. And this is tied closely to the cuboid biomechanically because of the connections and attachments of the perineal muscles that hook around the cuboid. The fourth indicator is when you do the clinical test for the displaced cuboid and the fifth metatarsals are unable to dorsiflex against a stable cuboid. This means that the articulation between the cuboid and the fifth met is compromised. Okay, once we've established your patient presents with one or more clinical indicators justifying mobilization of the cuboid and that your patient doesn't have any of the contraindications present, the next thing we need to do is set up our patient and ourselves to effectively deliver the mobilization. Hey, if you've got a person or even a skeleton to practice on the setup positions, that'll help you enormously, so go get one. All right, first, the patient position. Have your patient seated comfortably in a supine position. Make sure their heel is supported on the table or the chair and not hanging loosely off the end of the treatment table or chair. That's Ted's tip number 1. Make sure the patient's foot is supported by the treatment table or chair. Next, your position. The best position is for you to be at the foot of the table facing towards your patient's face. Your medial hand, that's the hand between your patient's feet, will lightly stabilize the foot by holding the forefoot comfortably. Your lateral hand will isolate the cuboid accurately by identifying the styloid process and sliding medially and just posteriorly to the styloid process. The thumb of your hand will sit on the medial aspect of the plantar surface of the cuboid. So Ted's tip number 2 for effective inversion mobilization of the cuboid is this. Make sure you're contacting the cuboid on the medial side of the plantar surface of the cuboid. To ensure you're on the right contact point, your thumb should be right on the non-weight bearing skin adjacent to the weight bearing skin of the heel. Make sense? Great. Now, your fingers of your lateral hand will clamp around the dorsum of the cuboid. This will generally be right over the extensor digitorum brevis muscle belly. You see, the cuboid is more medial than practitioners usually think. That's Ted's tip number 3. Position your thumb and fingers more medially and more proximally than you think. It's probably the most common rookie mistakes I see when teaching this technique is incorrect surface anatomy by being too lateral and too distal. So go more medial and more proximal. Now for the action, which is going to be to invert the cuboid, isn't it? So to do this inversion action, you're going to extend your wrist like this, and the action will invert the cuboid. Make sense? Great. So the action goes push, hold, 2, 3, release. Then repeat. Push, hold, 2, 3, release. Now you'll repeat this action 3 times, which you should notice an increase in the cuboid inversion with each mobilization. If the cuboid's really stuck, it might take another 3 repetitions to release the cuboid. A total of 6 repetitions in all. Okay, look, I'm going to cut now to an actual cuboid mobilization technique so you can see it happen in real time. How was that? All clear? Great. I can tell you, if you just use that technique as a cuboid range of motion test on your next 6 patients, you'll practically be a master ninja practitioner immediately. So get your hands on as many cuboids as you can. The more experience you gain, the faster you'll discover the finer and finer distinctions about the cuboid, like how stuck it is, how free it is, how it responds to your mobilizations. One final tip is this. There's actually a particularly sensitive point on the medial aspect on the plantar surface of the cuboid. This forms because of the deep ligament, the cuboid navicular ligament that runs across here, gets stressed when the cuboid is everted. So if you press your thumb on this area and it's sensitive, you've found the right spot. Keep your thumb there, press harder, and charge for the trigger point therapy. How cool is that? Okie dokie. So for the prone cuboid mobilization, all of the clinical indicators that we've already covered, they apply for the prone cuboid mobilization as well. You know, I prefer mobilizing my cuboid patients in a prone position because I can use gravity to help generate the force, and it's also easier on my body, which is a good thing. The second advantage is when your patient's not watching you, they're less likely to engage in conversation while you're working. All of your attention is on what you're doing rather than diluting it by engaging in conversation. Then you're providing a better quality of focused service. As a side note, it's a policy in our clinics that all practitioners deliver their mobilization services in silence. That way your patient knows what you're doing is really important. And the more, it's much more important than discussing the footy or the weather or what you're doing for dinner that night. You can chat to your heart's content once you've finished the mobilization service, if that's your thing. Now, I know that human beings don't handle silence particularly well. The way we handle that is we just have some gentle music in the background. If the patient starts talking, we just gently say, "Mary, great question. I'll answer that when I'm finished." Now, you can have that as an additional tip from Ted. Provide a quality service by putting all of your attention into the most important part of your job, and that's getting your patient's problems fixed. Okay, now for the setup. So the patient's lying face down in a prone position. The knee will be flexed around 90 degrees so that the foot is about your chest height. This is a very ergonomic position for you to work in. You'll be standing at the foot of the table, facing towards your patient's head. Your medial hand will have the thumb contacting the medial border of the cuboid on the plantar surface. Your lateral hand will support the lateral beam of the foot. Now, take note of the position of the thumb and how it supports the dorsum of the 5th metatarsal shaft. Now, an important tip from Ted here is the long axis of your thumb, wrist, and forearm. They need to form a straight line, otherwise you'll stress your joints if they're flexed. It also dissipates the force that you're generating. That means you'll be wasting energy, so make sure they're all lined up straight. You'll also see how the long axis, which is the line of drive for the mobilization action, is directly vertical. This is how I'm using gravity to help me generate the required force. If I'm at an angle or off vertical, it's just more work for me, and well, I like to be as efficient as possible, so that's why I'm highlighting this for you. Your action will be the same as for the supine mobilization, which is push, hold, 2, 3, release. Then push, hold, 2, 3, release. Again, you'll repeat this action 3 times. How many times? 3 times. You should notice increased cuboid inversion with each action. If necessary, apply another 3 repetitions to a stuck cuboid, meaning a total of 6 repetitions in all. And that's job done. As a bonus, I'll show you how you can also use this prone cuboid mobilization technique by standing on the side of the table. All the principles and forces are exactly the same. Have a look here. But now you're thinking, okay, so I've been able to free up the stuck cuboid. What'll keep it free? Great question. And that's what we'll cover in the next 2 lessons of this module. The exercises that you need to gain long-term correction, plus how to use a cuboid notch pad most effectively and most accurately. I look forward to seeing you there. Until next lesson, serve with spirit, consult with care, and help more cuboids today. G'day, welcome back. In this lesson, we'll dive into the most effective mobilization techniques to free up stuck cuboids. This is where you get your hands on feet to use a highly... Now, both techniques work equally well. The reason why I'm giving you the 2 options is so that you can do the mobilizations in whichever position suits you. Some practitioners do foot mobilization therapies with their patients supine, and others do it with their patients prone. I'm going to let you decide what works best for you. Therapeutically, they're both as good as each other. Effective treatment option for cuboid-related problems. This is an invaluable skill that's revolutionized how cuboids are treated all around the world. In this lesson, I'll show you 2 cuboid mobilization techniques. The first technique is when the patient is seated in a supine position. Second technique is when the patient's lying face down in a prone position. Everts, meaning the plantar surface of the cuboid faces away from the midline of the body. This happens in the frontal plane. So that means the direction of correction required to restore the cuboid to its optimum functioning position is going to be to invert the cuboid. That's because, as you know, inversion is the opposite of eversion. Okay, there's a number of setups. Alrighty then. You'll remember in the first lesson how we discussed why cuboids get stuck in the first place. If you haven't watched that video, go back and do it, because this lesson is based on the principles presented in that first lesson. Okay, so do you remember the typical displacement pattern that the cuboid goes into in the pronated foot pattern? Well, the cuboid typically